We are now hearing in some level of detail from the mayor about plans to reopen Philadelphia. He has been very direct, saying that once we get past the most deadly and vicious part of this outbreak, that the financial consequences, especially for the city of Philadelphia, will be severe. So far, COVID-19 has cost Philadelphia 206 lives and tens of millions of dollars, scaling the city's hospital capacity, competing with other cities and states for medical supplies, and stopping an economy that produces $388 billion a year was just the start.
How much money does Philadelphia need to get back to even?
We don't know at the moment. Those calculations are ongoing, and we don't know we know generally how much we've spent. But we don't know how much we're going to spend.
What have you spent so far?
I don't have that in front of me right now, but we've appropriated $85 million. I do not believe we're through that yet, but we'll probably go through it.
Mayor Kenny wrote Congress asking for flexible funding in the next round of federal coronavirus relief. He says tough choices are coming as we slowly ease social distancing and our economic pause. He has said some city services will need to be cut, but has not identified which ones. The consortium of governors from Massachusetts to Pennsylvania is coordinating a regional reopening plan. So far, few details are public. We do know, like every city, people still need to stay home. Before any reopening, Philadelphia will need widespread testing to make it work. The health commissioner says right now that is a significant barrier.
The countries and the cities that have had the most success in opening their economies have rigorous testing capacity. What is Philadelphia doing to increase its ability to test people?
Doctor?
Yeah, let me try to answer that. There are several things that are limiting our ability to test, and this is a big problem. It's a big problem in Philadelphia. It's a big problem nationally. There is a limitation on the number of swabs used to collect the samples. There is a limitation on how many tests a laboratory can do on a certain day.
And at this point, there is no set date for reopening the economy in Philadelphia or in Pennsylvania or New Jersey or Delaware. The first priority here in the city of Philadelphia is to make sure that when the economy does slowly start to open, that new cases don't emerge and you don't overwhelm the hospital system. Then it is all about building consumer confidence, and you cannot do that without massive scale of testing, because you need to know who is sick, who is not, who needs to be quarantined, and who can go back to work. That's the latest in Philadelphia. I'm Mitch Blacher, NBC10 News.
You know, Mitch, you've been reporting from Philadelphia since this shutdown began. So how important is the city, is Philadelphia, to restarting the regional and really the national economy as well?
It's a huge deal. Philadelphia is the economic engine of the region, and it's significant for the United States. Nationally, the economy would be slowed without Philadelphia. Regionally, it just simply wouldn't go. Philadelphia, to give you an example, generates about $388 billion economically every single year. That makes it the fourth largest municipal economy in the United States and one of the 10 largest municipal economies in the world.
Wow. All right, Mitch Blacher reporting live tonight. Mitch, thank you.